Another common problem we see in the foot is the ganglion cyst. And of course, common question, which is how do I get rid of a ganglion cyst in my foot? And the answer is a little bit funny. Well, dark humor funny, because back in the 17th and 18th century, there was the Bible technique. And no, it did not involve praying or reciting captions. It is actually the weight to the Bible slamming on top of the ganglion cyst. The most common part was on the top of the foot here that we see off different structures. But that would rupture the cyst itself, scar down, and remedy the problem with one swift blow, and patient probably biting on a towel. Well, now we have better treatments, and you can draw this fluid out because, again, this is coming from a joint or a tendon. And all it is a weakening in the structures on the outside. It fills up with a fluid, turns into a little bubble, of course. They're harmless. They don't morph into anything dangerous. You can even leave them alone. That's a treatment. But usually the patient wants the mass drained. We can perform that in the office, very easy with a syringe. And then you can inject some cortisone around the area to decrease inflammation and sometimes scar down the ganglion sac, if you will. If they keep reoccurring, of course, surgery is an option. These are very easy to remove because they're right at the surface of the skin. Unless they're coming from deeper structures in the ankle, once in a while, those take a little bit more exploration and time. But again, once they're out, and if they're ligated, which means pinched off at the base, maybe a bovie and burned to retard the growth from coming back, these problems do not come back. And the healing time is very easy. When the sutures are removed at 2 weeks, you can go right back into shoes. If you'd like to see these types of surgeries, you can log on to my YouTube channel, which is Dr. Robert J. Moore III. You can see this and other foot and ankle surgeries. More Ask Dr. Moore surgeries are on the Ask Dr. Moore site. That one you can see other questions and answers that we had for different foot and ankle problems, as well as lodging your own, and I'll do my best to get to that. Again, hope this was helpful for you. Stay healthy and one step ahead.